Hello, hello. So this is Dr. Amigues from Unabridged MD. Today I would love to talk about placebo. I've realized that not everyone understands what placebo is about, and we sort of all have an idea, and we place a lot of qualification, emotion to this word. And I just want to discuss it so that we all understand what it really is and what it is not, and also how we can use it to our advantage, really. So, for those of you who are looking at the YouTube channel, I've put just one example of a trial here where we're seeing a drug, abatacept, which is a rheumatologic drug for rheumatoid arthritis, against placebo. And the reason I chose this is just to show how a trial is done. And so we're just going to look at this, right? So when you're looking at a new drug, what you want to do is that you want to prove that it is efficient against placebo. The reason you want to show that it is efficient against placebo is that you cannot just look at it from a pure perspective of like, look, we can do this versus nothing, because you will always see a difference. If I give you a pill that has nothing in it, the chances that the pill actually will affect your joint, for example, or the way you feel, is around 30%. Sometimes it's up to 50%. And basically, it's not ethical to say that a new drug is efficient if you don't study it, what we say against. We use the word against placebo. And really the idea here is to say, look, we know that placebo, so placebo comes from liking, that you're gonna like him, right? Like you're gonna like the placebo, it's something that you like. And if you're going to study a drug and you're going to give it to some people, the chances are that it's going to work. There's like 1/3 of people who will work. The only way that you can show that it's working better than a placebo is if you test it against placebo. But I absolutely love the studies because we always see the difference there is against placebo, right? So for example, in this study, but there, like literally, if you look at any study out there and it's against placebo, you can really see how it can work. And in rheumatology, the power of placebo is increasing since, the more we do studies, the more there's a power of the placebo, which is odd. And it's been studied because we are trying to understand why is it that there's more placebo response than before. And there's a lot of thought. Maybe the way that we include patients has changed. Maybe just patients have an expectancy, like they expect that the drugs are going to work more, and so on. All right. So the reason I put this chart here is just to show that even with placebo, even with something that has no active drug in it, right? There is an effect, and the effect is not null. The effect is, and here it's like almost 40%. No, it's 44%, right? And if you look at the, it's probably not a person actually. This is a functional score, a physical composite score, and the other one is a mental composite score in this case. But some other times, some other scores. And what you see is that there is clearly like an increase over time of the placebo effect. And then usually what happens is that the placebo has a tendency to stabilize, whereas when a drug is active, it usually still continues to grow a little bit and then stabilize, right? The reason I'm sharing this is that we've got to realize that we are not inert, and that the placebo effect, we shouldn't say negative thing against the placebo effect, and we want to use the placebo towards, like, for us, right? So, for example, the best of the best studies are what we call randomized controlled trial, double-blinded against placebo. So randomized control trial is that you're giving the drug by chance. So you have basically a way to give by chance the drug versus the placebo, okay? Double blind means that the patient doesn't know what they are getting. Are they getting the placebo or are they getting the drug? And it looks the same. So if you're giving an injection, it's going to look the same. If you're giving a medication, it's going to look the same. And you're trying to make it taste the same and so on. And double blind because the physician is also blinded to what the patient is getting, right? And so you have zero bias in terms of, do I believe that this drug is going to work as a physician, or does the patient believe that the drug is going to work as a patient, right? And so I find it extremely fascinating because even in trial, where you could actually argue that the placebo is probably less than in a regular practice because the doctor doesn't know what the patient is getting and the patient doesn't know what he is receiving, that maybe the placebo effect is actually much higher when you give a drug to a patient with whom you have a good relationship and where you're trusting that that drug is working, right? The reason we have to take this into account is that the words that your doctor is using is extremely important. If he gives you a drug and tells you this is not going to work and the chances of you having a ton of side effects are super high, well, the chances are you're probably not going to respond to that drug and you're probably going to have the side effect and the side effect that he talked to you about, right? Or that you may have read or so on. But if I tell you, look, this drug has really shown a ton of improvement in this or that studies, and I really believe that it's going to work for you, right? And that you, as a patient, takes the drug and like, well, yeah, it's going to work for me. I believe in this drug. I've heard about it and I've read about it and I understand the mechanism and this is going to work for me. Your chances of responding are much higher. And the same way, like I think it's important to realize that when you give a placebo, it can be a placebo to please, that's the word, right? Or it can be a nocebo, not to please. And the nocebo is sort of the opposite, but it's not exactly the opposite. Nocebo means that you're going to have harm from something that has no active agent, yet there is no active agent and you're still having harm, right? And so if I tell you, well, in this trial, you may have this side effect, that side effect, this side effect, etc., but I still don't know what you're getting. And you actually have a ton of chances of developing side effect from what we would call a placebo. And in this case, it's a nocebo. And I find it super fascinating to me because it's really the power of the mind over the body here, right? You're taking a placebo, you're responding. You're taking a placebo, you may even develop some side effects from it. And that's something that's extremely important because I need, as your doctor, I need to make sure that you understand that you may get a ton of benefit from a drug, right? And I need you to believe so that I can take the placebo for you, so that you can use the placebo in your on your side, 30%. You want this on your side. So this is to me, this was extremely important when I was going under chemo because as a stage 4, you don't really know if it's going to work or not. I mean, at any stage really. But as a stage 4, I would say that the importance of chemo for me was even more so because I knew that that's kind of like you need chemo to take care of the metastasis. Yeah, sure, you can do radiation therapy, but like chemo is really going to be a big part of it. And I remember thinking like, oh, maybe I should ask my oncologist to give me a placebo. Well, first of all, we're in the US, so probably she won't give me a placebo. And second of all, I just thought like, how can I get the power of placebo on my side? And I don't have an answer, but I think one of the way that we can tap into the power of placebo is to look at the drug for what it may actually offer. And I do this a lot with my patients. And I'm like, look, I want you to start visualizing that you are going to have no more joint pain, that you're going to be able to run the marathon that you've always dreamed of running, and that you will not have, that you are gonna benefit from this drug without any side effects. And it's very interesting to see that most of my patients have zero side effect. And it's usually the people who are feeling very fearful of starting a new treatment that have that develop side effect. And so you can just work on the power of the mind of how, what am I afraid of in this drug? Because those are very important, right? Like you may be afraid of heart failure in one drug or infection in another drug, and then okay, this is what I'm afraid of. Okay, what will I do if I get those, right? So in case of an infection, well, you treat the infection. You make sure that you don't just continue to live your life without doing what needs to be done for the infection. If you have heart failure, you're going to stop the medication, and you're going to make sure that you tell your doctor that you have shortness of breath or lower extremity edema and so on. But I think it's really just important to be like, well, I know that those are signs that I have to, when they show up, be concerned, but I'm not going to go there. What I'm going to go is I'm going to try to go where I'm healthy and I tolerate this drug very well and where this drug actually really works. All right? That's really like almost like a visualization, but realizing that that's what the power of placebo, that is what placebo does. When you're taking a drug, you're like, yeah, maybe I got the drug with the medication in it, and maybe it's going to work. And just use that to your advantage. And yes, it is true. You know that the drug that you're taking is the real drug. So that's even more powerful, right? So yeah, I hope you understood what placebo means, what we mean by nocebo, what we mean by, randomized controlled trial against placebo, and blind versus double blind. I don't think that that's so important as realizing the power of your mind. And that you can work with your mind and getting it on your side so that you can get the best of the medication. Because the medicines today are extremely powerful, but your mind is also powerful. And putting both of them together is really what, for me, this unabridged care is all about. Is let's not just take one against the other when we're saying a drug against placebo. It's not against, right? Yes, I need a trial to show that this drug is actually better than a placebo, because otherwise I would give you placebo. But use the placebo. Use the power of the mind to feel better, to be better, to do better stuff in your life, to get to a better you. Because you can, because that's the power of our mind. And we physicians, we know about this all of the time. And I think we sometimes feel very shy about sharing it with our patients. But as a patient myself, I can tell you I've used it. I want the power of placebo on my side. All right, so this was Unabridged MD, the podcast and the video. And please, if you like this, share, put some comments, tell us how you have been able to heal, tell us what has been hard for you, what has worked for you. I'm going to have a guest on the podcast very soon. I want to share all the hope there is in medical care. There is a reason why we call it hope driven by science, because I believe in science and I also believe in hope. And I think that care that's driven by hope is so powerful. Please subscribe. Send this to another of your friends, and I hope to see you next week. I hope to talk with you next week. I hope to see a ton of comments, and thank you so much. With gratitude, have a wonderful week. Take care, everyone.